Hi, this is Dr. Rajesh Simon. I am a foot and ankle orthopedic surgeon working in Kochi, Kerala, in both Aster Medicity and Lakeshore Hospital. I also am this year's, that is 22-23's, president of Indian Foot and Ankle Society. So what is trending today in foot and ankle is we have a whole change of our lifestyle today. Sports injuries have increased quite a bit. The longevity of life has increased quite a bit. So sports injuries has got different problems in the ankle and foot. The understanding of the dynamics of foot has got better. So we are today looking at a lot more treatment in sports injuries in the ankle and the foot problems. As the age grows, the geriatric problem, the arthritic problem, we are looking at the ankle replacements today. So multiple levels of ankle replacements, different level of reshaping of the foot, diagnosing it rightly, which was not done 20 years back, is what is trending today. The second part of the trending is the diabetic foot. We have a whole lot of people, we will be 49% of diabetes would be in India by 2045. That is what the figure is. 5 to 9% of them converts that to Charcot disease. It's a Charcot neuropathic disease where the bones disappear, bones disintegrate, and the patient's shape of the foot, the shape of the ankle, the stability of the foot, everything is lost. The patient cannot walk. And that is something which we should understand to diagnose. I want all the physicians, all the surgeons who are treating this Charcot foot as cellulitis to understand that this is a whole lot of change from what cellulitis is managed and Charcot foot is managed. The problem is the diagnosis of the Charcot foot. Charcot foot has to be diagnosed first. It should not be treated or diagnosed as cellulitis with some small antibiotics. We don't need antibiotics here. We need to diagnose it and treat it. And if you see Charcot, we have 5 to 9% of conversion. So we are looking at a population even more than the whole of population of Denmark. So that is where today's problem is to diagnose. And once you diagnose, we have a whole amalgam of treatment management. From the plaster to major surgeries, the whole idea is not to amputate a Charcot foot. Please do not amputate, because if you amputate one foot, there is 50% chance that you amputate the second foot in 5 years' time. And if you amputate both the feet, there is 50% to 56% to be precise mortality rate in 5 years' time, which is way more than a cancer treatment. The challenges which I face in foot and ankle is because of the new subspecialty. People still are not ready to understand, because they have been told by umpteen number of people that this is not a problem, this is the problem. So I have to make them relearn things. The lot of problems, lot of deformities, lot of sports injuries, Charcot foot, which I said, are treatable, are manageable by non-surgical and surgery. Simple heel pain need not be given steroid injections. It should not be given painkillers. Just simple stretching exercise is good enough. From simple stretching exercises to major surgery of reconstruction is what we have today. The challenge today for all of us at Foot and Ankle Society in India is to make people understand, even to the physicians, to the surgeons who are senior enough, that there is a treatment available. There is a patient who's not able to walk can walk with a proper treatment, be it non-surgical or surgical. We have a whole lot of things which is recently developed. The understanding of genetics, the understanding of 3D modeling is way ahead in getting our foot and ankle problems in general and the whole of body, but let me specify on foot and ankle, the ankle cartilage injuries, which was not treatable few years back. Now we have genetic therapy. We have 3D modeling where we can replace that cartilage with specific models. These are the key advances that is happening today, which was not there even 5 years back. So today we are doing surgeries with 3D modeling, with genetic understanding, with DNA understanding, the 3D printing of deformities to correct the deformities by 3D printing and understanding it and doing it in the patient. The whole lot of things we can do today with the technology and make the patient walk pain free. I, as president of Indian Foot and Ankle Society, actually took up this year the theme as Save the Charcot Foot from Catastrophe, because after I started seeing foot and ankle problems, I saw a whole lot of Charcot foot which was mismanaged and were even amputated. Just seeing them amputated one leg and then amputating the other leg after a few years was something shocking to me. And I took up this challenge of spreading the knowledge of Charcot foot. And today we've held many CMEs across India, teaching the orthopedic surgeons, teaching the general physicians, please understand, don't treat Charcot foot as cellulitis, don't treat it as infection. It is not infection. It is the disintegration, the complete solution of disintegration of the bones, which is leading to the swelling, the redness, and not an infection. So please, first diagnosis is very important. And if you diagnose it in an early stage, a simple plaster can save the patient's life, limb, quality of life, the money needed for the patient and for the family.